Good afternoon, everyone. I'm honored to be here with you all today to recognize Black Maternal Health Week. Before we get started, I would like to acknowledge the many community organizations that we have represented here today. The African American Health Program, if you're here, come on up as we call you. The Department of Health and Human Services, the Fetal and Infant Mortality Review Board and Community Action Training, the Montgomery County Collaboration Council, the Babies Born Healthy Program, and the Advocacy Interest Group with the Howard University College of Medicine. Thank you all for being here today and for the work that you do. Today is the official day of International Maternal Health and Rights, a day to advocate for eliminating maternal mortality globally and to present a proclamation to our incredible community leaders and organizations working on an issue that should not exist in our county, let alone in our country. I also want to take a moment to recognize that we are all here today without mothers and children who deserve a fair chance at life had we invested in programs that address disparities in maternal and fetal mortality rates. According to the CDC, Black women are 3 times more likely to die from pregnancy-related causes than white women. Further, in Maryland, the maternal mortality rate among Blacks is almost 4 times that of whites. These statistics are not new to any of us. We have been complicit for far too long and must remember that these statistics are not just numbers, they are people. They are mothers who are no longer with their newborn children. They are children with a statistical disadvantage for simply being Black. When Black mothers discover the blessing of carrying a child, fear clouds an otherwise beautiful moment. Fear that their skin color will result in them becoming another statistic, amplifying what they already know. That our Black mothers and babies are dying at alarming and disproportionately higher rates than other races. I'm honored to present this proclamation in front of the council in a room full of fellow advocates who are equally outraged over these numbers, and legislators who share my commitment to making the necessary changes to combat this issue. Montgomery County can be a pioneer in creating a model that others in our country can replicate. We can be the ones to lead the change, and I am committed to working on just that with my colleagues and community partners. We can be an active part of the solution by normalizing trauma-informed care, prioritizing postpartum education and support during healthcare visits, countering implicit bias among medical professionals, extending Medicaid coverage up to 1 year postpartum in every state, and partnering with Black maternal health organizations. We have representatives from Black maternal health organizations here today who I would now like to invite to share brief remarks. We have with us Dr. Keisha Davis, Montgomery County Health Officer, Public Health Officer, Montgomery County Public Health Officer at the Department of Health and Human Services, Dr. Jermaine Williams, President of Montgomery College, Dr. Ann Kademian, Executive Director at the University of Maryland, Shady Grove, Lynette Byfield, a graduate of the Babies Born Healthy Program, Charlene Day, Nurse Case Manager for the African American Health Program, and Dr. Lauren Jenkins, former co-chair of the Fetal and Infant Mortality Review Board and Community Action Team. And finally, Brittany McClendon Weary, co-president of the Advocacy Interest Group at the Howard University College of Medicine. I hope everyone remembered their order. We're gonna start with Dr. Davis.
Thank you. Good afternoon, everybody. I'm Dr. Keisha Davis, County Health Officer. I'm also a family physician, a Black woman, and a mother of 3. And this issue cuts close for myself, for the patients that I care for. Councilmember Sayles has already read the statistics. I am not going to reiterate those. The statistics are staggering. We, as a country, as a state, should be ashamed of the outcomes that we have seen in birth outcomes in our Black mothers, and we need to continue to pull attention to that. Some of the folks here represent the programs that we are doing here in Montgomery County to expressly combat those statistics. And I want to invite Lynette Byfield, who is a graduate of one of our programs, Babies Born Healthy, to share a little bit about her experience.
Is there a way for me to bring this down? Thank you. Hello, my name is Lynette, and a little over a year and a half ago, I was a client of the Babies Born Healthy program while I was pregnant with my youngest son, Kingston. And when I found out that I was pregnant, I was excited, but I was also scared. And the reason that I was scared was because my first pregnancy ended in an emergency C-section. My son was in the NICU for the first month of his life. I struggled with breastfeeding, and I had issues with just not being able to bring him home. And I felt like a failure as a mom. When I got pregnant again, the second time, I learned about the Babies Born Healthy program, and I decided that I wanted to do things different this time. And everybody at Babies Born Healthy was very helpful. They were very kind. I enjoyed participating in the Zoom classes and the in-person classes that they held twice a month. I was able to meet other participants, and we were able to share our experiences. I learned about nutrition, I learned about well-being, child safety, pregnancy and postpartum warning signs. And I think one of the most important things that I took away from that program was the sense of empowerment. Babies Born Healthy taught us to be empowered. It taught us to advocate for ourselves, it taught us to advocate for our babies. And I tended to be someone that really didn't, I sort of deferred to what doctors said. I didn't really ask a lot of questions. I didn't speak up if I disagreed or I didn't understand something. And this program taught me to be vocal about what I wanted for my pregnancy and what I wanted from my birth. And I was able to follow through on that. It taught me to ask questions and keep talking until doctors listened, and I did that. Now, my transition after my son Kingston was born was not easy. I went from being like an already exhausted, overwhelmed mom of one to now having two very young children completely dependent on me. And the pandemic didn't help. I was not working, and I was worried about providing for my family. And once again, I was starting to have feelings of failure. And the support of Babies Born Healthy, they let me know that I wasn't alone, that I was dealing with postpartum depression, and that if I needed help, I could reach out. And after time passed, things got better. And my son, Kingston, is now a happy, healthy 1-year-old. And honestly, in an amazing turn of events, I am now a community health worker for the Babies Born Healthy program. So I get to support and empower women the way that I was supported. So I'm very grateful to Babies Born Healthy. Thank you.
Good afternoon. Thank you, Councilmember Sayles, for this opportunity to stand next to you to amplify the importance of Black maternal health care. We understand how important this is at Montgomery College, and we are here and we look at access and representation and fortified educational experiences. And when we think about how we can address healthcare inequities, we are right now enhancing the number of seats that we have by adding a nursing lab to our Health Sciences Center, by adding nursing labs to East County Education Center, by having high school students being able to be enrolled in a dual enrollment program in the nursing program. And that next piece of representation, serving our students who 25% identify as Black and almost 80% identify as a person of color, we can help to ensure that we're preparing the workforce for healthcare workers who look like our community members, which then goes to that fortified educational opportunity, some of which you said, Councilmember Sayles, ensuring that our curricula, as it does, looks at implicit bias, looks at what has happened throughout the course of our history that has caused these healthcare inequities, so that we can prepare our students for this both inside the classroom and during their several hours of clinical time. And that is all, supported by our excellent faculty and staff. So again, we stand firm with you in addressing healthcare inequities, especially Black maternal healthcare inequities. It is so important at Montgomery College. We want our students to change lives. We also want them to change the lives of those in their communities. Thank you again, Councilmember Sayles. Thank you very much.
Thank you so much, Councilmember Sayles. It is an honor to join you today and everyone here today to focus on Black maternal health. The alarming rise of Black maternal deaths in the United States is devastating and unacceptable, and it's a problem we must solve. And it's one we can solve, and it's one we can solve together. At the universities at Shady Grove, just like my colleagues at Montgomery College and other educational institutions, we are committed to the educational solutions to this problem. USG is committed to developing and supporting healthcare professionals, serving county and the region in their educational journeys so they have the technical knowledge and skills, but also the cultural humility to properly serve and care for Black mothers and children. USG is committed to developing and supporting the entrepreneurial mindset in our students for all learners and entrepreneurs who will create organizations and new systems that support Black maternal health, find solutions to systemic bias, and the provision of health care. And USG is committed to providing increasingly accessible and affordable educational options for all residents as essential for sustainable wage careers and a quality of life that is essential to good health as well. Thank you so much. We stand with you today.
Thank you all for the invitation. My name is Charlene Day. I am a case manager with the African American Health Program, the SMILE program, starting more infants living equally. Our goal is once the client is enrolled, we follow them for their entire pregnancy and until the baby is 1 year old. During that time, we address all their needs, their health issues, diabetes, hypertension, preterm labor, gestational diabetes. We make sure that they understand what is going on with their bodies, and we encourage them to advocate for themselves. By the time they leave the program, they are well prepared, they're knowledgeable, they know what to expect on labor and delivery, they're able to ask for pain management and know exactly which pain managements have the best effect on them. So we educate, we prepare for delivery, we have better outcomes. Our clients are able to verbalize what they have learned and how their lives have been improved with our program. Again, I am with the African American Health Program, the SMILE program. Thank you very much.
Dr. Jenkins?
Good afternoon. Montgomery County. Thank you very much for Councilmember Sayles for highlighting this important issue of maternal health. Our improved pregnancy outcome teams, the Fetal Infant Mortality Review Board, reviews Montgomery County fetal and infant deaths. We have an increased rate of death in African American infants and children of twofold. And this is independent of insurance status and greater than high school education. We also see that African American women have increased risk of problems during pregnancy, labor and delivery, and after pregnancy. Unfortunately, tragically, the CDC reports that nationally, African American women have a 3 to 4-fold risk of dying within the first year after delivery. In conclusion, thank you again for this proclamation, highlighting these disparities. It is our hope that with collaboration of institutions, clinical providers, and communities, we will truly be able to be happy about maternal health. Thank you very much.
And last but not least, Brittany McClendon-Weary.
Good afternoon, everyone. My name is Brittany McClendon-Weary. I'm a third-year medical student at Howard University College of Medicine. I aspire to be an OBGYN and currently, thank you, I serve as the co-president of the Advocacy Interest Group at Howard University College of Medicine. So we're an organization dedicated to advocating for our patients inside and outside of the hospital. So it'll be completely remiss of our organization not to highlight and emphasize the importance of Black Maternal Health Week. As many people have already said, Black women have almost three times more likely to die during childbirth than white women. And this isn't a race issue. I want to be clear on that. This is a racism issue. And it's going to take more than legislation like the Omnibus bill, which is amazing to get there. It's going to take all of us. It's going to take a community effort to really make a change and make Black women have more time with their little ones. So thank you again for this opportunity, Councilmember Sayles, and happy Black Maternal Health Week, y'all.
And so want to thank everyone for coming in today and want to grab a quick photo with all of our organizations and advocates who are represented here today. Let's get in a little.